Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about the neurosciences, which has to do with care of the nervous system and the brain. We'll meet three specialists who are part of the Ochsner Neurosciences Institute at St. Tammany Health System, and we'll learn about brain, spine, and pain management. We'll start first with Dr. Ben Brown. Dr. Brown, welcome.
Hi, Melissa.
Really glad to have you on the show. This is an exciting look at neurosciences, and I think an exciting advance in care in Covington to have the Ochsner Neurosciences Institute at St. Tammany Health System. So maybe start with a little bit about your background.
Sure. My name is Ben Brown. I'm a neurosurgeon. I grew up in this area on the North Shore and went through the LSU system for medical training, and then went away to Florida and did a fellowship there in a subspecialty of vascular neurosurgery, and worked there for a little while, and now I'm back and happy to be home in St. Tammany.
That's exciting. And you're part of a group that has brought neuroscience, so neurosurgery, neurology, et cetera, to Covington there at St. Tammany Health System. And I know that you all practice in all the different areas of neuroscience, but can you start us off by talking about the brain and some of the care that we're able to provide here locally?
Sure. And yeah, so I'm in a group of three on the North Shore neurosurgeons, but as you mentioned, caring for the brain and the spine, it takes a huge team of neurosurgeons, neurologists, therapists, intensive care specialists, and then the emergency personnel in the hospital. And so St. Tammany has done a great job of building kind of the full services around neuro. So from a brain standpoint, that mostly comes down to trauma, which is commonly encountered in the community, stroke, also a big deal in the community, and then things that are maybe a little less common, like brain tumors. So the common theme with all of that for people to know at home would be, the symptoms that come with something like a stroke. So like the acronym FAST.
Face, arm, speech, time, FAST.
That's right.
Yes.
So those things, if you notice facial drooping, slurred speech, arm weakness, time is of the essence and you need to get to the emergency room, that could be signs of things like a stroke, of which St. Tammany is a primary stroke center and has advanced techniques to help with that. But could also be other things like a brain hemorrhage, where neurosurgery can come into play, or things like a brain tumor.
Wow. I'm sitting here thinking about that. You know, you're sitting at home with your family, and a member of your family suddenly is unable to get their thoughts out, or you see their face drooping, you ask them to lift their limbs and they're unable to control their arms. That is the reason to call 911, thinking you have a stroke. But you're saying once we get there, maybe it isn't even a stroke, maybe it's something else. You could discover a brain tumor, all kinds of other things.
Correct. So, you start with an initial workup that's very fast in the emergency room, and then if very fast things needs to be done, they can be. Otherwise, it de-escalates to other pathways. And things that we've recently added at St. Tammany is the Neurointensive care unit. So we have personnel that are dedicated to the critical care of a neuro-specific patient. Previously we had critical care services, but they cared for the broad systems in the body, all systems, but now we have a dedicated neuro unit. So people who have very complex issues with, brain hemorrhage or brain tumors can be cared for in a very specific way by a neurointensivist.
And that's, I think, a good indication of what St. Tammany and Ochsner are doing together. As we were saying, we have the Ochsner Neurosciences Institute with your offices there in the medical office building, connected by Skybridge to St. Tammany Parish Hospital, the flagship of St. Tammany Health System. And there you have operating rooms that have special technology specifically for neuro, and you have this dedicated neuro unit that has highly specialized and credentialed people who take care of neurosciences intensive care patients.
Definitely. St. Tammany's made a lot of investment in the infrastructure and the operating room for state-of-the-art sort of guidance systems for surgery. You know, I'll be doing a surgery later today where there's a small spot in the brain that we need to get to, and we need to use sort of GPS for surgery to design our incision kind of right over the spot that we need to go to, and, so that there's as little collateral damage in getting to the objective, you know, because obviously the normal brain we want to be, you know, very aware of and not injure.
That is pretty fascinating stuff. That's the bright matter technology that we have invested in. And I love your reference to GPS, because I know when we bought that technology, we did a little bit of education about it for the community. And we talked about how brain surgeons have to get to the tumor, and to have that technology that helps you find the most direct pathway to that tumor for removal saves brain, and therefore can save people's speech or ability to walk, or all of those things that our brain controls for us.
Right. So it's great to have that locally here and not have to travel for patients for those things. Additionally, the cancer center that the St. Tammany Cancer Center that's opened up locally from a neurosurgery and neurocancer care, we're doing focused radiation procedures to certain tumors. So I work with a team of neuro-oncology and physicists there to work together to design plans, and we have special equipment there that can do similar laser-focused type of surgery for a tumor that's inside the brain that's maybe too dangerous to go from an open surgical technique, and we can apply, you know, focused radiation specifically to a tumor and avoid all the critical structures around that. So
that is absolutely fascinating. So, you know, you're thinking about the Neurosciences Institute at the Medical Office Building. Across the Sky Bridge, the hospital has the operating rooms and the neuro ICU, and then down the street at St. Tammany Cancer Center, which is a campus of Ochsner Medical Center, you have those specialists who, in conjunction with you and your partners, are able to do intervention with radiation on, as you said, inoperable brain tumors. That is absolutely astounding. And then let me take a step back and think about what we talked about at the top of the segment, and that is, completely aside from cancer or brain surgery, stroke. You have the trauma center and the stroke center there in St. Tammany Health System's emergency department.
right.
Well, Dr. Brown, I have to tell you, I'm sort of blown away with the level of specialty care the Ochsner Neurosciences Institute brings to St. Tammany Health System. I appreciate you coming in and teaching us a little bit about the brain aspect of it all.
Sure.
And I'm really glad to have you back home. It's good to know you're local and that you came home. That's exciting for us. Thank you. You're watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about the neurosciences. We'll be right back.